Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. You're watching the Need to Know show. For today's episode, we're going to talk about language, the language we use as physical therapists and as patients, and how that language sometimes can be harmful, and how we can also use that language to be beneficial, positive, and uplifting. So, a lot of times when you have knee pain, when you have knee arthritis, when you have knee replacement surgery, when you have any type of damage or something going on with the knee, there's a lot of different language, different vocabulary that's used, different terminology to describe things, describe what's going on. Now, sometimes this language can be detrimental and can really promote a negative attitude and a negative feeling. So, in general, we want to avoid these terms that are very negative and promote this feeling of hopelessness or feeling like you can't do anything about what's going on with your knee. And so, some of the common things we hear are, wear and tear. You hear bone on bone, degradation or degenerative changes. You hear cartilage decay or destruction of the joint. And terms like these can be really negative and can really give this perception in your mind and in your head that what is going on at your knee you can't have any impact on and you can't have any effect with. It makes it sound like this is a term that, the damage is done, the degenerative changes have happened, and you can't do anything about it. And it's really this idea of helplessness, of, self-efficacy and able to adjust it and change it. That really is deterred and taken down by using these certain terms. And the thing is, these terms are so prevalent and so common that you almost can't be someone who has knee pain or knee arthritis or a total knee replacement and hear these certain terms. What we really should use is an alternative is just call it on joint pain or knee pain. I have joint pain. I have knee pain. And the reason for this is when you look at knee pain and you look at knee arthritis and you look at a total knee replacement and your recovery in your body and your knee after a total knee replacement, it isn't just this inevitable progression into destruction, decay, degeneration, things getting worse and worse. It's not inevitable that all this is going to happen and you're going to have a bunch of pain, a bunch of swelling, tightness, discomfort, all of these negative things going on. Instead, you want to think of your joint and your knee, as well as just your entire body and your legs and your body in general. You want to think of it as something that is dynamic. So the tissues, the muscles, the bones, the cartilage, the ligaments, all of this is very dynamic tissue. It's impacted by all sorts of different things. It's impacted by your activities. It's impacted by the biology and your systemic system. It's impacted by all sorts of different things. And pain itself, the experience of pain, is also very impacted by all sorts of different factors. There's the physical factors, but there's also the psychological factors, there's the biology of your body and how it experiences pain, there's past experiences, all sorts of different things play a role. So the big word that you want to use and think of it as dynamic. When you have pain in your joint, either from arthritis or from a knee replacement, you have to remember that the tissues, everything is in a repair process. It's in the repair phase. It's not in the degenerative phase. We can do certain things, exercises, physical activity, things like that. They're going to help this dynamic, changing tissue be more toward repair and recovery and getting better than that degenerative, negative, inevitable changes that we often hear about when we talk. So some other things to think about is you really just want to avoid language that promotes fear, promotes misconceptions and misunderstandings, right? Just because you have some level of arthritis or just because you had a knee replacement doesn't necessarily mean that you're destined to have pain, destined to have swelling, destined to have stiffness, or destined to have these very significant levels of this. You want to, avoid language that promotes misunderstanding, and you also just want to have this overall acceptance. You have to have an acceptance of what's going on before you can start to figure out the ways to manage it effectively and to make things feel better and get back to feeling better and doing the activities you enjoy. So, like I said before, it's a dynamic. Arthritis and joint pain and knee pain and knee replacement surgery is dynamic, it's complex, and the changes and what you're experiencing is very complex, but it's something that is progressive, something that is changing constantly. And you want to have the mindset and the concept, and it starts with the words and the language that you use, that there is hope, there is optimism, there's reason to be positive, and there's reason that through management strategies and through doing your rehab or whatever it may be and other strategies, you're able to manage this. You're able to manage what you're dealing with and what's going on, and you're able to decrease the pain, you're able to improve your function, you're able to improve your mobility, and you're able to get back to different activities and tolerating more activities. So when you use certain language, it's really going to reflect on the mindset and your overall mindset. So avoid the language that is misleading, goes to misconceptions, is negative, is fear-provoking, is feeling of low self-efficacy and low level of optimism or hope. And instead, let's focus on the language and focus on the things that are positive and are looking at things at what really is going on. Things aren't inevitable. It's a progressive. What you're dealing with is the knee pain, the joint pain, swelling, stiffness is something that's progressive. It's something that's dynamic. Your body has the ability to repair, restructure itself. This is something that takes time, takes patience. There's all sorts of factors at play, and we have to accept those different factors and know that just because my x-ray looks like something, or just because I have these certain symptoms right now, that's not inevitable that that's what it's going to be. And it's not going to be progressively worse and worse and worse. There is the ability to improve. There's an ability to decrease pain, to feel better, to move better, to just have a better overall quality of life. And the main thing is all this starts with the language you're using and the language of the people that are around you. So if you're interacting with your physical therapist, with your surgeon, whoever it may be, listen to the words they use, listen to the phrases they use. And if it sounds like this negative stuff, say, look, I don't have degeneration. I don't want to talk about the bone on bone. I don't want to talk about cartilage damage and destruction and degeneration. I want to talk about the fact that I have joint pain, I have knee pain, I have knee stiffness, I have swelling. Those are the things that are objective. You can know that you're experiencing those things. And I know that it's a dynamic process, it's a complex process, but there are ways that I can personally do certain things through physical therapy, through different management strategies to help improve what I'm experiencing, decrease pain, improve function, improve mobility, and feel better. So that's the message I have for you today, everyone. Happy Saturday. Hope you all have a great rest of your day. Again, you've been watching the Need to Know Show, and we just talked about language and the different language we use and how we can use it to, instead of in a way that's going to hurt us and make things more difficult, we're going to use it in a positive manner, a manner of hope, a manner of positivity, and a manner of understanding that we can be optimistic and we can improve what we're dealing with. All right? Thank you very much for watching, everyone. Take care.